Assalamu alaikum. We're gonna continue on with our Q&A series. Inshallah, we're gonna be addressing again something relevant to the holy month of Ramadan. This has three particular points that we're gonna try and address. One is pertaining to nursing or breastfeeding mothers. Are they allowed to fast during the month of Ramadan? So the response that was provided, and inshallah Sheikh Mujtaba can elaborate further. If a woman has little milk and fasting would harm her or the child, she is breastfeeding. And this breastfeeding is the only way to feed the child. There is no, for example, practical alternative like a wet nurse or formula. Then fasting is not obligatory on her. She must give 1 mud of food to a person for each missed day and make up the fasts, which is considered qada later. And if the alternatives exist for feeding the child, it is problematic for her to skip fasting solely on this basis. The second part is, can pregnant women fast during Ramadan? In this particular one, the answer that was provided is that if she is in an advanced stage of pregnancy, getting closer to the delivery date, and fasting is harmful to her or the unborn child, then fasting is not obligatory. However, she must give 1 mud of food to a poor person per missed day and perform qada later. If, however, she is not in an advanced stage but fasting causes harm or unbearable difficulty, then fasting is also not wajib or obligatory on her, and she must perform qada later with no fidya required in this case, unless, of course, she is delaying the qada until the following Ramadan. In cases of serious harm, breaking the fast may even become wajib or obligatory on the woman. There's also people who tend to have to take certain medications. So what is the ruling for those who need to take medications while fasting during the month of Ramadan? The answer that has been provided is that taking oral medication, pills, liquids, or otherwise, intentionally during fasting hours generally invalidates the fast, as it constitutes eating or drinking. If the medication is necessary during daylight hours and cannot safely be rescheduled to before Fajr or after Maghrib without causing harm, the person is excused from fasting that day due to the illness or fear of harm. They must, however, make up the fast as a qada later. And if the underlying condition makes fasting harmful, maybe someone has a chronic illness during the daytime hours, then the exemption applies similarly to the other illnesses and no fasting is required, with qada obligatory afterward. Non-oral routes like injections do not invalidate the fast, and fasting should not cause basically undue hardship. So we'll turn that to Sheikh Mujtaba to elaborate on this further.
Thank you. Assalamu alaikum wa rahmatullah. Very brief, inshallah, since the questions were clear, and I think the answers are pretty clear and self-explanatory, but just quick comments on some of those answers. Regarding the nursing, the advice that is often given is that the mother tries, and if she feels like she is affected or the baby is affected, there's the baby's not settling and hungry, not getting enough nutrition, then obviously she is not so she's not mandated to fast on that day. She's exempt, and she would have to pay that fidya and make it up later on. Fidya is 750 grams of the general food, rice or wheat or things that are generally consumed. Now, if she can give other, or the baby starts eating solids and is in later stages of their nursing, then that exemption is not automatic. Hence, if she is unable to, and there's a serious problem, it would not be a regular exemption. With the pregnancy, very similar. Earlier stages generally don't have an exemption unless there's a medical advice from a doctor, a trusted doctor, not one who, there are some who just say, okay, you're pregnant, don't fast. And you ask many people who fasted and it was not. So if if you consult with doctors and they are genuinely advising for the health of the mother or the child that they should not fast, then they can be exempt. Now, why is it that in later stages they pay fidya and then earlier ones do not? Later stages, they have that exemption in the hadith with the fidya. Earlier ones are considered by basically by general difficulty or inability to break one's fast, which means there's no fidya, but qada, and only pay fidya if you don't make it up, because generally whenever one is sick, unable to fast, they would only pay the fidya if they don't make it up before the next holy month of Ramadan. I think that covers it. The last one with medications, and so the Maraja, they say if you are able to inject, not all, by the way, not all the Maraja consider injections as as an item that does not invalidate fasting. You have to check with your Marja, but Ayatollah Sistani says if you're able to inject the same medication, then it does not invalidate the fast. But if one has to take it orally, then it would invalidate obviously the fast, unless they can schedule it in a way that's before or after. And if they cannot, and they have to take it during the day, then they would break their fast and then make it up later on. And if they make it up before the next month of Ramadan, there is no fidya. Alhamdulillah.